Hello, friends. This is our AI A to Z course, and I'm Dr. Sonali Tamankar. Today, we have AI for the Mentat. T is for training data. AI systems need quality data to learn from. Garbage in, garbage out. So, where does the data come from? These days, pretty much every move we make is being recorded by someone somewhere as data. You buy a cup of coffee and pay with your credit card. Congratulations, you have just generated data for the coffee shop, for your bank, and for your phone company. You walk out with your coffee, there are street cameras that can see you. Your smartwatch is counting your steps. You pull out your phone, scroll social media, watch a video of a cute kitten, which posts you clicked on, how long you watched, all of that gets recorded. We live in a sensor rich world. With IoT or Internet of Things, we are absolutely drowning in data. But raw data is just that, raw. Before it can teach an AI system anything, more work is needed. That's where ETL comes in: extract, transform, and load. The unglamorous but critical world of cleaning and preparing data so that models can actually learn from it. One limitation is that data lives in silos. Take healthcare as an example. A hospital might have access to your lab values and your diagnosis, but they typically don't have your smartwatch data. So, if they are tracking a diabetes patient, all they may know is how much exercise a patient reports doing. Your smartwatch company, on the other hand, has detailed activity data, but they don't know you have diabetes. And neither of them may know that you are paying off student loans and can't afford healthy groceries. Even with all of this data being generated, no single AI model typically has the full picture. On top of that, data is incomplete and buggy. I work in healthcare, and if we believed all the data blindly, there would be people walking on this earth who are shorter than a chihuahua or taller than a giraffe. Human data entry makes mistakes. Speech to text systems make mistakes. One of my favorite clinical notes said, patient has a forehead and is wondering what to do about it. To this day, I have no idea what that was supposed to mean. Some AI models, especially deep learning models, can handle large amounts of messy data and still learn useful patterns. Other algorithms need more careful setup, which brings us to feature engineering. Features are specific inputs a model uses to make predictions, like age, lab values, vital signs in a healthcare risk model. We actually measure patient height and weight, but when we calculate their BMI and use that as a feature in our model, we are doing feature engineering. Sometimes these derived features are more informative than raw measurements. Also, we don't necessarily want to use every piece of data we have. A hospital may know your eye color, but that's probably not useful in predicting diabetes risk. Part of feature engineering is deciding what is relevant and what's just noise. Sometimes we augment the data we have or even create synthetic data. If we are training an algorithm to recognize dogs versus wolves, we might take the images we already have and generate new versions by rotating them or zooming in slightly. This helps the models become more robust. In healthcare, synthetic data can help when we are dealing with rare diseases where real examples are scarce. We learn the overall patterns of the training data and then create new data points that look similar. This can also help protect patient privacy. Instead of using real patient data directly, we are generating new data that represents patients with similar characteristics. Another technique is mix-up. For example, AI in cars might train on superimposed 50% transparency images of a pedestrian and a car. This keeps AI from becoming overconfident, and it helps it handle situations like fog or a person stepping out from behind a vehicle. Note, this is an example of soft labels like we talked about yesterday: 50% person, 50% car. Okay, let's now talk about bias in training data. Our worldview is sometimes distorted, literally. Like the Mercator projection world map that most of us grew up with, it systematically distorts the size of countries. So Greenland appears the same size as Africa on this map, even though Africa is about 14 times larger. Other projections, like Gall-Peters, preserve area and distort shapes instead. So our training data had similar distortions. We talked earlier about how much data gets captured when we buy a cup of coffee. Meanwhile, someone living in a remote rural area on another continent might go through their entire life with very little data about them ever entering our systems. AI models never see that data. So these people are effectively missing from the data map. If we want AI systems that are truly fair, we need a better projection of human data. So that's why there are global efforts to deliberately collect more diverse training data. Some efforts focus on speech data from people with different accents, dialects, and languages, because early voice assistants were trained on a very narrow slice of speakers. Others work to collect images across a wider range of skin tones. In healthcare, initiatives are underway to go beyond data collected just from major hospitals in wealthy urban areas. For example, the All of Us Research Initiative aims to gather data from 1 million or more participants, with nearly 50% of its genomic data coming from racial and ethnic minority groups. I'll link all these references below. Efforts like H3 Africa, Human Heredity and Health in Africa, and TopMed, Transomics for precision medicine, also work to diversify genomic data. So it may seem like there is too much data everywhere, but the reality is far more nuanced. Generative AI adds one more layer. When the first wave of models were trained on the internet data and books, all of this content was generated by humans. This is not true anymore. There is now a lot of LLM generated content online. LLMs have consumed most of the gold standard, purely human generated data that was available. And now the internet data is contaminated by the LLM generated data. So, what happens if we train AI on AI generated data? Researchers have found that AI models collapse when trained on AI generated data recursively. As more AI generated text, images, and videos flood the internet, AI systems can increasingly end up learning from content created by other AI systems. This creates feedback loops. Patterns get exaggerated, mistakes get repeated, and diversity slowly disappears. Models misperceive reality and become narrow and brittle, a phenomenon often called as model collapse. Second, some data is actually created specifically to mislead algorithms. This isn't a theoretical risk. We know click farms generate fake engagement or to game recommendation systems. Fake reviews are written to trick ranking algorithms. Coordinated networks produce spam content to manipulate search results. So companies like Google have been spending decades fighting exactly this problem, constantly updating their systems to detect and remove content designed to influence algorithms. Now such fake data can be generated by AI at a massive scale. So not all distortions in training data are accidental. Some are deliberate attempts to exploit how algorithms learn. So you see why we needed an entire episode on training data. Whether it's a Mentat or an AI system, when they're trained on incomplete, biased, or corrupted data, they can make consequential mistakes or can even be systematically misled. Okay, so we saw today that training data is plentiful, messy, incomplete, biased, scarce, and corrupted all at the same time. Transforming raw data into clean feature sets for AI algorithms takes a lot of work, and a lot of efforts are underway to collect representative training data. So tomorrow we have U is for UMAP, where we'll look at fun images and talk about concepts like dimensionality reduction. So see you then, and bye for today.